Let's get right into it. I'm really excited to introduce this next speaker because he's from my school. He is from the University of Calgary. I'm a proud graduate, BA 1994. I know that was like the Stone Age, but I still have a good connection to my university. Dr. Andrew Szeto is currently the Director of Mental Health Strategy at the University of Calgary, responsible for guiding the implementation of 28 recommendations within the University of Calgary campus mental health strategy. Now, interestingly, not terribly long ago, I sat down with the president and vice chancellor of the university, Ed McCauley, and it was interesting. We had a bunch of things to talk about. He wanted to talk about this. So you've certainly got the attention of the president, sir. Dr. Szeto is a principal investigator at the Mental Health Commission of Canada as well, and an associate professor in the Department of Psychology at the U Calgary. Over the past 10 years, he has focused on the development and evaluation of workplace mental illness stigma reduction and mental health promotion programs, such as the Working Mind and the Working Mind for First Responders. Now, he's done a lot of work, including working with post-secondary students, and he's even developed programs for junior high and high school age inquiring mind youth is what that one's called. Dr. Szeto continues to publish academic articles, of course, on various topics related to mental health and well-being and the stigma of mental illness. And what I think is interesting about his placement today is he's going to give us a sense, discuss some of the evidence for, and make the arguments why mindfulness and mental health promotion should be included in that sort of holistic approach to reducing the stigma of mental illness. So welcome, Dr. Szeto, and over to you for your 30 minutes. We are excited to learn from you.
Well, thank you. Hopefully everybody can hear me. Good afternoon. Thanks for having me today. It is a great pleasure to be here. And I had a chance to listen this morning to some of the intro talks, and this conference and the intent of this conference has really resonated with me. The themes about caring community really resonate with what I do at the University of Calgary, leading the strategy there. Our tagline is creating a caring campus community, and what we're doing here is bringing people together and creating the caring campus, or that caring community that we all need, especially during this time. So let me just share my screen with you and begin my talk. I'm going to do something a little bit different in the sense that hopefully you can see that. I'm going to do something different. I'm not sharing my PowerPoint, but I'm sharing a PDF slide, and I find those a little bit easier for me to present on because there's less moving parts. But what I want to, and then Ken mentioned, the talk, and that's exactly correct. I want to talk a little bit about mindfulness within the context of a holistic approach to stigma reduction. This is the work that I've been doing for the past 10 years or so, is really looking at the stigma of mental illness and trying to reduce that, creating programs to reduce it, creating programs that give skills and to improve mental health. Beyond what I do at the university with our campus mental health strategy. But just to give you a little bit of a roadmap today, I want to first of all give you a definition of mental illness stigma and how I usually define it and how I talk about it within the context of our research and in talks like this as well. I also want to talk a little bit about what we know about stigma reduction and some of our current approaches to reduce stigma. And then I finally want to end off with talking a little bit more about where mindfulness fits within stigma reduction. And as a stigma reduction tool or approach, this last part I think is partly grounded in the research that I've looked at, as well as I think mindfulness is important in that it ties everything together. It's a holistic approach, and I think the theme community is also important. So again, I think this is a very important point, how mindfulness fits into everything. So I'll talk about that last. First of all, so let's talk a little bit about what is mental illness stigma. And you can also see a nice picture of the University of Calgary. Ken, I'm sure you've walked through these sidewalks on campus as well. But first I want to talk about Irving Goffman. Irving Goffman is actually from Alberta, or was born in Alberta and lived in rural Alberta, if I'm not mistaken. But he is one of the first scholars. He's a sociologist and a psychologist. Kind of a distinction between there. But Irving Goffman is one of the first individuals to really write about stigma in an academic sense. And his work has been very influential in the work that's been done now and in thinking about stigma. But his book Stigma notes on the management of spoiled identity. How he defines stigma is an attribute or mark that reduces the bearer from a whole person or whole and usual person to tainted and discounted one. Others have built on this definition. So for example, you're looking through the literature, you could see a mark of disgrace associated with a particular circumstance, quality, or a person, or difference or whatever, right? So this has been how stigma has been defined. And, I personally think this is, although it has been lost to spur on research and really the discourse on stigma, I think it's outdated and inaccurate. And this is the stigma definition that I use, and I really lean on Lincoln Phelan, who published an amazing treatise on stigma. They define stigma as a complex process of interconnected components, rather than this just mark of shame, right? So what they say about this process is that human differences are labeled, so whether it's differences in gender or differences in how we look, differences in our skin tone, or differences like having a mental illness or not. These are labeled. These labeled differences are then attributed to a negative attribute, or a negative attribute is assigned to it. So people with this specific difference are viewed, less than those without that attribute. And this leads to separation between, well, that's them over there, and this is us, right? Which leads to discrimination and status loss. I think some of the important parts of Lincoln Phelan's definition of stigma is that, it applies to multiple identities. So whether it's for those who are differently abled, those with mental illness, ethnicity, race, this stigma process does apply. And I think some of the most important, so these last 2 points are what I think is the most important thing about their definition of stigma, or Lincoln Phelan's definition, is that it changes the perspective of how we think about stigma, from the onus being on the person that is stigmatized to the stigmatizer and the broader context. So, this ties into the last point, that stigma exists at multiple levels. And I'll get into a little bit about that in a couple of slides. So, these are some common portrayals that we see of stigma, or of people with mental illnesses in the media. You see, the derogatory language. You can see that here, portrayals in the media, especially in the news media. And, a lot of the work I've done in the past has, or a lot of my colleagues' work, their work has been done to really address some of these issues within the media. And I think we're having some successes with that. And again, these depictions, I would say, fit within public stigma is part, and maybe sexual stigma, but these are the different levels that we can broadly think about stigma existing at. And, a lot of us are very familiar with public stigma. So, and this is what I termed interpersonal stigma. And this is, in our everyday interactions with others, we might experience prejudice, discrimination, depending on, the difference that we have, whether we have a mental illness or race or whatever. So this exists at the interpersonal level. But then we also have a couple of other levels of stigma that generally broadly fits within what we're talking about here. The first part is structural stigma, and this is the bigger piece, right? These might be things that exist, such as policies, laws, or systems that are discriminatory or exclusionary based on, again, these differences that I've been talking about. And they exist at the cultural level, at the organizational level, and again, broadly within our society. And if you look at kind of the bottom level, we also have intrapersonal stigma, or what I call, or in the literature, self-stigma. And this is, what this is individuals, for example, who have a mental illness, they internalize those, negative experiences, those prejudices, those negative attitudes, and internalize them. When I say that, I mean somebody takes them in and believes them and applies them to themselves. So, one example of this is, for example, I do a lot of work in the workplace, implementing programs. So somebody with a mental illness, depression, anxiety, doesn't really matter. They hear others talking about individuals with mental illnesses saying, for example, they're lazy, or, people with mental illnesses are just crazy, right? So this person who hears this might internalize this public stigma, say that, well, I guess so, I guess that they're right. And, so I'm somebody who might be lazy, right? So, within a context of the workplace, this individual who has internalized that stigma, the public stigma, might say to themselves that, oh, well, here's this job that this posting for this promotion. I think I'm qualified for this position. I have all the skills, but I have a mental illness, and that makes me not very good, or that makes me incompetent. So I'm not going to try. I'm not going to apply for it. So, those are some of the impacts of internalizing stigma. So this is what we call the why try effect. But its impact is essentially lowering self-efficacy, lowering self-esteem. So this is stigma at the 3 different levels. And I think it's important that we talked about this because, again, most people are familiar with public stigma, but not necessarily structural stigma and intrapersonal stigma or self-stigma. And self-stigma, I think, really plays into the impact of mindfulness. And I'll, again, get into that in a couple of slides. So I've given you a definition of stigma and how I think about it and how I think about it within my research. Let's talk a little bit about some of the current approaches that we use to reduce stigma. Here's a kind of a thought, or well, I guess it's more of a truth and a fact within my research area. We're very good, I think, at reducing public stigma, or pretty good at it, but I don't think we're very good at reducing self-stigma or structural stigma. We're trying, right? We're doing both. I'm, recently working on with a bunch of colleagues, looking at structural stigma within the healthcare system. So we're doing that. Self-stigma, there is starting to be quite an emphasis on that, but it's still, growing and maturing. But we do have a lot of different ways where we try to reduce public stigma. And I'll talk a little bit about that in the next couple of slides. So first, what I want to do is show you a quick video. I'm just going to share my other screen here. And hopefully you can hear this. Okay, I'll expand that.
You can see it.
Oh. It was a lot of hard work that I needed to put in, and like nights of not sleeping. And that's when I was questioning myself. Am I supposed to be here? Do I fit in? I just felt like, oh, I'm just not good enough. I'm not smart. University is not for me. And that's when it kind of hit me that like I need to change. I need to do something. I just can't let this be. I think it's mostly just taking my mind away from school. It's like dance is something that I can focus on. Like it's a single task that I'm just focusing on. There's no school in my head, nothing else. It's just the music and me just expressing myself. When I'm dancing, it just feels like I have control over my emotions. You can express what you're feeling inside. Dance is all about resilience. You challenge yourself to do something, and then you have to practice, and then you reach that goal. And then it just boosts your confidence. You have this new sense of self-esteem, and that really did help.
Okay, let me just share my other screen again. So that was Ramika, and she's an alum alumni now, but she is a very active student, a student leader. She was a co-president of Sportif YCC. I don't know if she is still now, but again, she is really talking about her experiences with mental health concerns or mental illnesses, and and things that she did to really get past that. And this is what we call contact-based education, contact hypotheses, or contact in general. But what we do to reduce stigma, and this is probably the best way that we know to address stigma or to reduce it, is to really have those with mental illnesses or mental health concerns really talk about their experiences with the illness, but also really focus on help seeking, focus on recovery and treatment, and really be a positive model for individuals out there. So this is, as I mentioned before, one of the best ways, if not the best way, to reduce stigma. A second way, and again, this is supported by research as well, is knowledge, right? Increasing knowledge does help to reduce stigma. So increasing mental health literacy, so understanding signs and symptoms of mental illnesses. I know that's there's quite a bit of research on that. I'm a little bit of a different belief that we don't necessarily need to know the specific signs and symptoms of all the mental illnesses, but more generally, our mental health and well-being. But that's up for debate. But also knowing things like resources is important. We also try to debunk myths and really give factual knowledge as well. So things like, people with mental illnesses are not incompetent, they're not dangerous, they're like you and I. So giving that factual information and appropriate language is important as well. So here's some resources that on the right, yep, this is the right-hand side here. You can see some of the resources that we have at the University of Calgary, for our staff, faculty, and students. Access to mental health here on the bottom. And then Community Connect YYC is such a great initiative here in Calgary, where several, I think 5 or 6 or 7 different community organizations came together to really offer these supports for those who need them. So I talked a little bit about language. Person-first language is very important. It does make a difference, we know, through just using it and through speaking to individuals with lived experience of mental illnesses, as well as through the literature that person-first, right? So use person with a mental illness rather than something like a mentally ill person. Avoid using words like crazy or psycho. When talking about suicide, say die by suicide as opposed to committed suicide, for example. So, and those are some other things that I talked about at the bottom there. Is this enough though, I ask? Can we do more than just having people with lived experience talk or giving knowledge? This is great and we're doing this, but can we do more? And I would say yes. And so this is where mindfulness comes in. Before I talk a little bit more specifically about mindfulness, I just want to talk a little bit about the dual continuum model. And I think, how I think about mental health and mental illness really falls in line with what we're talking about here. So we've talked about mental illnesses generally. When I talked about stigma reduction, it does refer to mental illnesses and reducing the stigma related to that. But I think what we're doing is really missing this part of the dual continuum model. And what the dual continuum model is really saying is that somebody can have positive mental health and still have a mental illness. And somebody with mental illness can have poor mental health, or somebody with no mental illness can have poor mental health, right? So that these are kind of separate from each other, and we aren't doing enough also to take care of our mental health. And mindfulness for sure, really addresses some of these deficiencies in mental health, or addressing our mental health. But we haven't been focusing enough on this part of the dual continuum model. So when I talk about mental health, it is positive psychological well-being, positive emotional well-being, and positive social well-being. And I think that given, well, I'll show you. So again, I'm just saying this again. So we all know mindfulness is important for many different reasons, and I don't have to teach, talk to you about this. The less stress, improved sleep, increased resiliency. We know all that, right? Psychological dimensions of quality of life, depression, anxiety, coping styles, all these improve with mindfulness. But mindfulness has other benefits beyond what we've discussed right here, or what you've been talking about throughout the conference. Now, this might seem a little bit complex. I'm going to lead you through, but there isn't too much literature on this. But in what I can find, I developed this model here, or kind of put it in a picture form, and I'll guide you through this. So the research that I've read is saying that having higher trait mindfulness, so this is different from a mindfulness intervention, but having a higher trait mindfulness, so being more self-aware, non-judgmental, and things related to that, this lowers self-esteem, stigma. So it lowers that internalized sense of, I can't do it, or why try, things like that. This leads to higher help-seeking intentions, and presumably this should lead to more help-seeking. So that's one pathway, where mindfulness might reduce self-stigma. A second pathway, so having trait mindfulness, is related to the higher self-compassion, more psychological flexibility, which leads to lower self-stigma and improves our help-seeking as well. And finally, there are studies that show that higher trait mindfulness actually leads to straight to more help-seeking. So this is kind of just the words form of what I showed you in pictorial form. But this is the bottom here is what you should focus on, is that mindfulness as a potential intervention for reducing self-stigma and increasing help-seeking. So, again, the previous slide really talked about trait mindfulness, or having the trait of being mindful. But what if we, gave people mindfulness, the skills to do mindfulness, help them with their mindfulness practice? I think, based on the literature here, it would be a very important intervention for reducing self-stigma and also increasing help-seeking. Secondly, the importance of mindfulness for reducing stigma. So what we're doing here, or what you're doing here with mindfulness, is teaching individuals how to perform mindfulness, how to create a practice. And I think increasing skills and competence within the mental health realm also leads to stigma reduction. We've done this with other forms as well. So in some of the projects, or the programs that I've done in the past, we've given people skills, and that has led to stigma reduction. I won't talk about the practice support program, but on our campus, we have this skill-based tool here: ask, support, refer, follow up. If you suspect somebody is in crisis, what can I do? Right? So here are the skills that you can do, right? Ask, support, refer, follow up, and here's the examples and how you do that, right? So again, giving people skills reduces, in the mental health realm, increases their competence and reduces stigma related to mental illnesses. And I think teaching people mindfulness is that. And finally, we talked about community. So I want to kind of end off on this, because I think it's so important, especially given our time. So implementation of mental health and well-being initiatives, I think generally within an organization, so this would include things like having mindfulness within the organization, opens up discussion for mental health and well-being, creates a more supportive and compassionate culture, and creates those connections between individuals within that organization, and creates a sense of community. And I think that's one of the most important things, again, especially given our current situation. And here's some, just looking through the research, here are some quotes from individuals who did interviews with, researchers who did interviews with those who took mindfulness classes or did a mindfulness intervention. And what they're saying here is, I think that the social part is huge. Hanging out with others who are doing the same thing as everyone needs acceptance and inclusion. I think is just the friendship and relationship form would be a primary benefit. So these are, again, some of the quotes that are, within the literature that talks about the community building, the connection aspect of mindfulness. And again, I think that is so important. Having free and open discussion, creating that community about mental health, again, reduces stigma. And here's my take-home point, right? We haven't been very thorough in how we address stigma of mental illness, right? Only focusing on really half the problem, right? Addressing the mental illness part. But we haven't done our best to address the mental health part. And I think mindfulness could be a part of a holistic approach to stigma reduction. Mindfulness has other benefits beyond those, whether it be stress reduction or increasing sleep or other benefits related to that. Again, mindfulness reduces self-stigma, increases help seeking, giving individuals mental health skills related to mindfulness also helps reduce stigma. And again, mindfulness creates the connections and that sense of community, I think, again, that we so need right now. So that's my talk for today. Thank you very much. And I think we have some time for a couple of questions, right?
That's right. Thank you, Andrew. That's terrific. Really great information. Thank you for contextualizing where mindfulness sits, but also giving us a really clear sort of delineation of what stigma is. I learned a little bit around the notion of those different kinds of stigma and where this is placed. And I really liked the fact that mindfulness can reduce self-stigma, as you say, and also how increase health-seeking behavior.
Well, and I think that's sorry to cut you off. I think that is something that we can do more of, or at least more research of, right? Is to look into the link between mindfulness and self-stigma, and which again has that impact of increasing help-seeking in the future. So yeah, I think that's a very important point, and more research again.
I want to ask one question that it's somewhat personal. I'll just be honest. I've had some challenges with my own mental health, and I've just recently spoken out about that, and I'm finding some opportunities to do that, which I'm very proud of, but also honored to do. And it's interesting because other people in my circle, in my family, even the older people, there was a generation of people that said, well, just pull up your bootstraps and just sort of buck up. What are some of the effective ways of combating the mental health stigma, really when it comes to older generations who haven't been socialized in the way that you are doing now for a whole generation of young people?
Well, so first of all, Ken, thank you for, taking time to talk about your, experiences with, mental health or with mental illnesses, and like you say, I think what you said there is so important, having individuals speak up, right, about their experiences, normalizing that, even with the older generation, right, and because you're related to this older, within your family, for example, you have that older generation, seeing you speak out about it, but yet also seeing that you are, somebody that they care about, somebody who is successful. I think, again, speaking out does so much to reduce the stigma of mental illness, and I think you're doing the right thing there.
I'm happy to do it. Thank you, Andrew. I wish we had more time. I always wish we had more time on days of learning like this, but I really thank you. Thank you for the work you're doing at my school and for all those students. Like I said at the front end, I know this is a priority for the University of Calgary, and that's impressive from an institutional level, but also personally, thank you for the work you're doing for my fellow grads and students along the way. Have a good day.
Happy to be here. Good afternoon.